Thanks, Andy. So yeah, I think everyone's kind of new to this, really. I don't know how many years we'll continue to say that, but it feels like there's still a huge amount to learn. So what I thought might be most interesting to present here was an outline of our context-aware smartphone app for helping people to quit smoking. Context-aware is quite a kind of fancy term. It's not as context-aware as it could be. So part of this talk will be looking at what the sort of potential and future steps could be with this sort of technology. We're quite aware that, you know, we're sort of playing with kind of quite big tools that we don't quite yet understand. So we've taken quite a slow approach to evaluating how you might deliver support that's kind of aware of what's going on at a particular time. I'll kind of explain what I mean by that as I go through. I had a kind of typical background slide with a bit of information. I'd like to say that this is what led us to develop and start to test out our app. But on the next slide I'll explain perhaps a more profound inspiration for doing this. So we know that smoking is a chronic relapsing condition, and a lot of people try and quit every year. About a third of all smokers in high-income countries. But if you sort of follow them up after a month, half of those have relapsed, and over a year you find only about 5% still not smoking. Now, what's particularly interesting, and I've only really sort of zoned into this fairly recently, is actually early lapse during quit attempts. It's really predictive of a failure to quit longer term. So smoking in the first week is really highly predictive of a failure to quit. So there's Asher and colleagues did an interesting study where they used 3 different data sets, and they found that more than a 5-fold increase in the chance of relapse among those people who smoked a single cigarette during the first week. Maybe that's just an issue with measurement, and that by measuring early lapse you're kind of tapping into a relapse kind of measure. But experimentally it's been found that if you induce lapse in people who are trying to quit, then they're more likely to relapse than people for whom lapse isn't induced, or people aren't asked to smoke. So there has been a lot of talk about mobile interventions being a kind of new way of intervening, and given that these lapse events seem to be quite important and quite predictive for people's success in being able to quit, then there's potential there to kind of intervene in real time to maybe prevent these early lapses. Whether that then increases someone's chance of quitting, we don't know yet, but there's good reason to think that this is going to be helpful. So that's a kind of general background to some of the work that I'll be talking about. But actually, it was doing a study some time ago now with pregnant smokers, where we were talking to them about how they thought a text message intervention could help them to quit. This is before we actually started using SMS to deliver smoking cessation support. And a number of them were saying that they expected the technology to interrupt their kind of daily routine, to get in the way when they were going to reach for a cigarette. Just a couple of quotes from this. So one says, if say you got up and you normally had one in the morning, and someone texted you going, "Don't have the first bag," you'd be like, "Oh no, I won't. Of course I won't." Whereas normally I'd just be like, "Oh, I'll just spark up quickly." And this other person says, "I don't know, but unless it's when you're just about to light up a cigarette, you get a text, then you might put it back in the packet, but I don't know." She was particularly resistant to kind of the idea of quitting. But this kind of I sort of thought about this for a long time, because we had approached this whole area thinking, well, what we were using SMS for was to sort of package up a smoking cessation program into little bite-sized chunks and just to slowly drip feed that to someone, so that over a period of time they kind of learnt about the skills of how they might quit smoking, provide general encouragement. We hadn't really thought of it to intervene in kind of real time, even though the technology is kind of interrupting them in real time. But we're quite mindful of the fact that it's very difficult to do this and to know when people are likely to be wanting to smoke, when they're at greatest risk of a lapse during a quit attempt. So it kind of bubbled away, and sort of was whirring away in the back of my head for some years. I didn't actually know kind of how to resolve this sort of tension. We did, with our text messaging interventions, we did, like other groups that have developed tech support, kind of try to take into account this and try to deliver some support which is tackling kind of in the moment issues and giving people facilities to do that. But as I'll go on to say, I don't think it works very well, actually. And I think the kind of approach we're now taking is likely to be more fruitful. Before I do that, I just wanted to kind of recap on something which is quite key with smoking and understanding smoking events during a quit attempt, and that is craving. You guys probably know a lot more about craving than I do, because a lot of this comes from experimental work. But so craving's a pretty big sort of factor in lapse. It's being generally considered to be split into two different types. Background craving, which is kind of connected to low blood nicotine levels. It's the kind of hunger that smokers describe, and it's generally what medications primarily kind of target, certainly nicotine replacement therapy. And then there's a second type, episodic craving or cue-induced craving, which are cravings that are induced due to cues in the environment. Some big ones are the presence of other smokers. Sorry, I realise. See, now you can just about see that. The presence of other smokers in an environment, rapid changes in mood, and then maybe other things which are sort of specific to individuals that are for them connected to the behaviour of smoking. And just the presence of these cues can bring on cravings. And that obviously leads to, in many cases, leads to smoking, or at least a temptation to smoke. Now, actually quite a large proportion of lapses during periods when people are trying to quit seem to be due to these cue-induced cravings. So Saul Schiffman and some of his EMA work has shown that almost half of lapses are looked to be due to cue-induced cravings. And it's a little bit of a gap in terms of the kind of support that's offered, in my view. Lapses tend to occur quite quickly after craving episodes, unsurprisingly. Again, from the same data set, Saul Schiffman found that half of lapses occurred within 11 minutes of a craving onset. So we're talking about quite short periods of time. Maybe an opportunity to intervene, but it's going to be quite difficult to get in there within that time period. And this is just highlighting that there are obviously sort of learned associations that you're primarily dealing with operant and classical conditioning, which might explain the relationships between the cues, the response, and so on. Okay, so we might want to potentially intervene at these different kind of levels, so we could maybe try to help people avoid the cues in the first place. We could help to prevent the cues driving the craving behaviour, so sort of extinguish these pathways. And then if someone does experience a craving, we could try and guide them away from smoking as the response, or help them kind of manage those cravings in a different way. So there's obviously a number of different sort of points at which you could intervene. Now, traditionally, and I mean traditionally by kind of what we do at the moment, aside from smoking cessation medications for a moment, in terms of behavioural support, what we do is we just tell people about these events, and then kind of send them on their way, and then hope when they're faced with these sort of situations they'll know what to do. I don't think there's a great deal of research that has looked at what people actually enact to prevent themselves from smoking. There's evidence that when people do something, either cognitive or behavioural, it does look like it helps, and helps quite a lot. but the sorts of strategies people use, well, the research that we've done suggests that they're not the evidence-based ones. They tend to be the things that are easy and easily memorable, like thinking about something else, or playing, sort of doing something with your hands. And not to say that those things can't be effective, but there are other kind of techniques and strategies that have a better evidence base that may be more effective that the people aren't using. So you can kind of tell people what to do and then hope they do it. It'd be nice if you have all these good-looking health professionals here. They can follow you around all day. I think for some of them that might be quite nice. And they could sort of, ultimately not necessarily in person, but another alternative is for them to kind of constantly being kind of attentive and aware of what you're doing. That's obviously not feasible. So a smartphone is an obvious choice for intervening at these different points. And this is where Geofence and some of the work we've done comes into it. Before I talk about Geofence, I just wanted to highlight 3 different ways in which I think mobile phone-based interventions can address these sorts of cravings, cue-induced cravings, or moments or cues that people get from their environment that drive people to smoke. So the first 2 are things that we've tried in our SMS text message interventions. So one thing you can do is you can get the user to trigger it themselves. So aside from just sending them away and saying, try and remember what I've told you and enact that when you get a craving, or when you think you might be doing something that's high risk. You can say, well, in this case, okay, if you find yourself tempted to smoke, then you could text, use a keyword, on your phone, text help, and you get a kind of response back. And a lot of the SMS interventions do this, pretty much without exception. What do we find? That people don't really use it. So very low usage, and I've looked across quite a few studies looking at slightly different approaches in different countries. So far I think everyone's shown pretty much the same effect. You only get a very small minority of people who actually use them, and those who do use them only use them kind of once, maybe twice. So people are kind of experimenting with it, maybe seeing what it's like, what happens when they do it, but I don't think they're using it strategically. I've not seen any evidence that convinces me. Same for interactive voice recognition, kind of dialing in, having kind of audio sort of support, rendering and craft, did a study on that. So I'm not convinced yet that user triggered is going to really kind of address this issue. I think actually when someone is tempted to smoke, then they have kind of mixed goals in that moment. And the goal might not be to help themselves to not smoke. So there's a number of ways in which that might not work very well. The other approach, and that's the other part of what our SMS systems do, and most other kind of just-in-time support, is to try and guess when people are going to most need help. So in the mornings, the smoke due to sort of low blood nicotine levels probably, and sort of routine, so you can kind of try and fire things off at about the right time when they might be having breakfast and the sort of post-breakfast cup of coffee and so on. But it's going to be really hard to actually find the right moment because everyone's routines are going to be quite different, and it's going to be very difficult to actually time that and coordinate that with actually when they are tempted. Even within an individual, their routine's going to change from day to day, weekends, weekdays, and unless you have a real barrage of questions at the beginning and really try to explore what someone does, and even that's likely to be difficult to recall from an individual. You're very unlikely to get in the moment. So I think you can deliver useful advice around the time when people might be tempted to smoke, but probably unlikely to actually be able to target specific events as they occur. So obviously then what we've been sort of looking at recently is sort of a hybrid between number 1 and 2, where you can basically use the sensors on smartphones to try to understand what's going on for the person at that particular time, so identify the context. and then use that to trigger support when someone's deemed to be in a high-risk situation. And this is often what's termed a just-in-time adaptive intervention, something that adapts according to kind of a real-time stream of information. Okay, so that's kind of what we've done with cue-sense. So just going back to this graphic of cue-induced craving and the cues and the response, I'll go on and explain what I mean by geofence messages in a moment. But we're trying to either directly or indirectly look at the situations and drivers of smoking, these links between the cues and the sort of response, cravings, and then what people do after those cravings. Okay, so how does this sort of context-aware triggering work? So I'll sort of show you a few screenshots of the app that we've been working on. The way it kind of works, this kind of component, there are a number of components within the app. Some of them are a bit more typical that you might find if you kind of go to an app store and download an app. But I'm primarily focusing on this sort of more novel aspect, which is kind of the key central component. So people would open the app, they'd complete some questions at the beginning, which are used to tailor bits of support. But one thing they do complete is they set a quit date, and they're told that every time they smoke, they press the I'm smoking button, leading up to that quit date. That then triggers a couple of questions. They'll be asked about their mood just before lighting up, their urges or cravings just before smoking, what situation they're in, and we've kept it very simple: home, working, socialising, and other, and then who they're with and whether those are other smokers or not. And what it also does is it captures their geolocation using GPS. So where exactly are you? So the idea is that if you report smoking enough times in the same place, that it kind of highlights that as a hotspot, or it creates a geofence around that area. So it's kind of, the app knows that this is a high risk situation. Now in our first version we've set this threshold to smoking 5 times in one place. We've in version 2 we've now reduced that to 2 times. That'll become clear why we've done that, I'm sure you can guess. So the app learns about where people are smoking, but also what's kind of going on. What are the likely drivers of that smoking behaviour for that particular place? Obviously, that may change. So, this is my workplace. It may be that stress is something that is a sort of factor in my smoking. So then, once quit date arrives, and I cycle to work and I cross into the geofence, then that triggers some action. It's up to us what we do with that event. How it works at the moment is 5 minutes into crossing into that geofence, it triggers a support message. And it will take into account what is learned about what's going on when I used to smoke in that zone before my quit date arrived, and it'll deliver a message that's tailored to what it's kind of learned about that situation. And so this, it's not a great example, but it does mention here how I can handle not smoking even if I'm stressed. So there's not very much. I can't find any research in the smoking field that's looked at this kind of any kind of context sensing that's used to trigger smoking cessation. There may well be stuff that I might not have come across. I'd be really interested to hear if you do know of some, because obviously we're really interested in finding out what other people are learning about this. And I've found very few actually for any kind of behavioural support. I've come across a few studies looking at sort of sedentary prevention apps, if you like, things that prevent, sort of get people to get up every half hour and stuff using sort of sensors in the phone. But it seems to be quite a sort of barren sort of research field at the moment in terms of, I'm sure there's lots of stuff going on, but in terms of what's actually kind of made it through and being reported. one big issue, and one thing that we were very interested in really early on, is how well people comply to completing the questions that we're asking them to complete. So, you know, there's a bit of literature that shows that when you rely on smokers themselves to report smoking, that you get generally lower compliance than when they're prompted. So we were quite mindful of this, given that our app was sort of partly, you know, quite dependent on people actually using it. If they didn't use it, it didn't really work. I'm going to go on to talk about a mixed methods study where we kind of looked at some of these issues and to see what smokers, how they found this kind of, well, this particular app and this kind of support. Just before I do, I just wanted to show you a few screenshots of some of the other bits of support that I mentioned, just so you believe me. So during the process of training the app, when people report smoking, after they've reported, they get a message of some kind. Sometimes it's feeding back on their behaviour, sometimes it's giving them a bit of advice about preparing for their quit date or their quit attempt. And these are sort of tailored to what people answered at the beginning when they initiated. All the messages they get go into an inbox so they can kind of view their messages. There's also a library where they can look at, you know, at any point they can go through and they can see, you know, get a bit of advice kind of on demand. Primarily, I think actually we sort of put that in because we worried that when people started the app, there's a bit of literature that showed people kind of want to get into and access a bit of content really soon off. They're quite annoyed if they have to wait around for things to be unlocked or whatever. So we wanted to give people some access to stuff early on. They can, all the information they're putting into the app, we're trying to find good ways of giving that back to them so they can learn about their smoking behaviour. And that's kind of part of the way the app could work. So here you can see, in fact, if I bring up the next screen, so they have like a my profile section, and every time they report smoking, it all gets collected, and they can, you know, look at their mood levels, and give them a kind of rough summary of how the relationship to mood and their smoking. So here it says, based on your reports, you rarely smoke as a result of low mood. And they can kind of explore that. I think there's room for expanding this and providing perhaps some more sort of interactive graphical features with that. But and they can add messages into a pool of messages to you know to help other people in a way of them sort of thinking about their own behaviour. Okay, so we, as I said, we're interested in getting a handle on how people found using the app and what kind of compliance rates they were likely to find in terms of people actually completing data entry. So we did a mixed methods study where we were using where the sort of primary data we're interested in was the quantitative data. And we used qualitative interviews with each person. And these were so data prompt interviews. These were where we gave people some of the quantitative data that they collected on the app to kind of prompt and cue discussion and so on, and remind them about the sorts of things that they were doing, really to understand the quantitative data. So we've got four main aims, and they're sort of split into the quantitative and qualitative phases. So we've got we're interested in their compliance in terms of, you know, reporting their smoking behaviour and so on, and their reasons for non-compliance, obviously very important. We're interested in the geofence accuracy. Sounds a bit more techy in terms of the actual the data that the phone's sort of collecting, but also feeding those back to people and making sure that when we gave them a map of where they've been smoking, they don't say, hang on, I've never even been to that street, that's completely wrong. I think it was important for us to ensure that we were kind of validating those self-reports. We were interested in sort of how feasible it was to trigger and deliver this kind of support, and get the views from the people on, from the participants on how it could be optimised. And ultimately, we are keen to identify any early technical issues. Of course, there are going to be technical issues, there always are. And so we can sort of look at that. Kind of connected to the technology, we're interested in data privacy concerns among participants. Given that we are collecting quite sensitive data, we were kind of knowing where they were most of the time in terms of their location. So we wanted to know what people felt about that. So we didn't need a big number of people to take part in this kind of study, given the objectives we had. We recruited 15 smokers who were willing to set a quit date, willing to quit, and had use of an Android phone. And that was harder than we thought, actually. But there you go. So we recruited kind of a convenient sample, really, through sort of general advertising and emailing companies who let us email their staff. People installed the app. They had a pre-quit phase where they'd train the app for, I think we had this too long actually, but for a couple of weeks. I think the average was about just over 2 weeks. And then they kind of used the app for a couple of weeks and then took part in an interview. So everyone was interviewed, well at least that was the intention, interview everyone afterwards. So we kind of had quantitative and qualitative data from everyone. Okay, so what did we find? So on average, people reported smoking 38 times pre-quit, which doesn't sound too bad, but if you put it in a per day amount, they only reported on average twice a day. But they were surprisingly light smokers, actually. They on average smoked, I think, about a baseline about 8 a day, and we also gave them end of day surveys every day because we wanted to kind of collect a bit of information every day, and also enabled us to compare their reports in real time with how many they reported at the end of the day. And actually, they only reported smoking about an average of 5 a day, actually. So 2 per day doesn't sound as bad as it at first looks, but we did find that on the majority of days they were under-reporting. It did take them long to report, though. So we were asking them a few questions, but on average it took them 18 seconds. So we thought that was okay. We thought it was fairly quick. We are quite interested in where people are reporting smoking. Again, that's not a surprising gap in the literature, as we don't really know where smokers smoke. We only found a very small number of studies which actually looked at this at all. And I think ours is the first which has some kind of objective data about that. Obviously, these are subjective descriptions of their location, but we do obviously collect the sort of geolocation data from that. So mostly people smoke at home, then at work, and actually home and work covered 80% of the smoking events. Socialising was quite small, and then there was another category. So those 4 categories, seem to kind of largely distinguish, identify where people were smoking. They tended to basically smoke where they spent time. That's what we concluded, looking at the background data as well, because every 15 minutes the app takes a snapshot of where they actually are, irrespective of anything else. And we can kind of map that against where they smoke, and actually they do tend to smoke where they spend time. That's our conclusion from this first study. So, okay, they didn't report all the time. Why not? So they forgot. Obviously, that's quite an obvious one. They didn't want to appear rude in social situations, in particular. Engaged in conversation, putting their phone out, and we didn't feel always that was an appropriate thing to do. Sometimes they would smoke when they drove. Obviously, we don't want them to be fiddling around with their phones in that case. A few cases, they didn't really understand the point of reporting smoking. They thought they could catch up at the end of the day. So that's kind of on us to make sure it's clear that they can. We really want them to report it at that point and explain the reason for doing that. And other reasons, when they sort of head towards relapse, they tend to just disengage from it. They found that they tended to report their first few lapses, but then they gave up. What we also found, which was interesting, was a kind of unintentional effect of reporting smoking, which was unintentional in terms of from our perspective, which was the act of self-monitoring when they were reporting seemed to, in some cases, make them kind of question whether they really wanted to smoke. As exemplified by this individual, who said, when I was logging how much I'm craving, it was lower than what I thought it would have been without the app, which was really good. So that made me think, well, actually, do I really need a cigarette now? So this person was saying how much they were craving just before they lit up, and they had a craving of kind of 0 or very low, and they thought, hang on, why am I smoking? I don't even want to smoke. So there may be some kind of other effects of reporting smoking that we weren't sort of capitalising on those in terms of changing people's smoking behaviour. So it's sort of interesting. Okay, geofence accuracy. 97% of the time when people were reporting smoking, we got geospatial location, and in fact I think the other 3% was all due to one person. I don't know what was going on. Maybe they had their phone on flight mode. That's one suspicion we had some of the time. But for those 97% of geospatial location collection events, then we've got accuracy of about 32 meters. So that's pretty typical for GPS. And the mean number of active geofences, so these are the number of hotspots, if you like, per participant, is 1.5. So that was a bit lower than we were kind of expecting. I think having a threshold of 5 cigarettes smoked or reported in the same location is too high, especially given that people are unlikely to use the app and train the app for as long as we kind of ask people to in the real world. Evidence says that people who download smoking apps tend to either be on quit day that day, or they've already started their career. Mostly. So actually, to expect people to be really prepared and download an app 2 weeks before they're planning to quit is not realistic. Importantly, when we show people maps of their smoking behaviour, they said, "Yep, that's all fine." There are a few exceptions, but to be honest, I don't think we believe them. We believe the data over there. And I think sometimes people are a bit, maybe they're not so sort of used to reading maps. But anyway, we were convinced that there hadn't been any kind of funny blips going on with respect to location sensing. You never know with GPS. If the Americans go to war or something and they suddenly kind of change their GPS accuracy, which I think they have done in the past, then you could get suddenly everyone's up half a mile to the west at all times. Hang on, but I recognise half a mile to the east, but not these other places you've got me smoking at. One problem we had was that not everyone who should have received the Geofence triggered support did. Only just over half, so 5 out of 9 people who were meant to receive these support messages didn't. I'll go on to explain one of the reasons why. Those who did received about 3 extra these Geofence triggered support messages a day. One thing which was we were quite pleased about, which was higher than we thought, was that quite a high proportion of these messages were rated. So I don't know if you've noticed, but at the bottom of all the messages, people can rate them on a 1 to 5 scale. We can do halves as well. And of all the generated Geofence messages, about 4/5 got some kind of a rating. So that was positive. It shows that people were engaged and they did kind of, one would hope, read the message to actually give it a rating. Another thing that's quite interesting is how long does it take people to respond to one of these real-time messages. And the answer is actually longer than, again, we were kind of hoping or expecting. So on average, it took people just over an hour to respond to one of these, real-time Geofence triggered support messages. I think this is quite important to really understand this, because it's, if we might have the technology to deliver messages, but if people aren't going to look at them for an hour or so, then we're not necessarily going to be able to target these high-risk moments. Or at least we need to work on how we improve the reading of alerts or response to alerts on phones. And there's a sort of emerging literature on that, which is very interesting. There's some useful tools that you can use to do better timing to sort of intervene at a time when someone's most likely to look at your message. But we still found that around 50% of people opened it within 30 minutes. So here we've got a a graph with time along the bottom and proportion of responses on the top along the side. And you can see that, so about 50% do it within 30 minutes. And it's quite a rapid kind of increase at the beginning, and then it sort of plateaus off until people probably just look at their phone for a different reason and spot that they've got a notification. One thing I had meant to present to you today, but it turned out to be a little bit more difficult than I thought, was to split this up based on location, so to see if people's responses to these alerts differed by the different places or contexts, and start to introduce a few context factors into that, like time of day, and whether that's a sort of stress place for them in terms of the smoking. I haven't done that yet. I've got like halfway, but that's no good for you today. But I think it's quite an interesting area to look at. So, with these JITIs, these just-in-time adaptive interventions, how long is it taking to people to respond, and under what circumstances, what factors affect that response rate? People were generally quite positive about these types of texts, and they sort of recognised that they were tailored to the situation. So this person says, but I guess it was kind of based on the time it knew I was at home or whatever, these sorts of trigger times, it sort of sent a message to say yes. So I felt it was aimed directly at me as opposed to just a random blanket message. And I think it's always useful if people kind of recognise that these are tailored to their event. What we've found in terms of the mechanisms of tailoring support is that perceived tailoring is really important. So if people perceive the support they're getting to be personalised, they're more likely to take it on board and act on it than if they felt it was generic. So even if we're not really doing a very good job of it, if they feel like it's sort of tailored to what's going on at that time, then it's more likely to have a greater impact. With all of this stuff, and I'm sure it has entered your mind already during this talk, if not before, is the risk of cueing people into smoking or thinking about smoking when they might not have been, especially in a high-risk place. So this is always something we're kind of been looking at and exploring, from text message interventions to this. What we tend to find is that people feel the benefits of the message outweighs the sort of potential harms of it. So in this case, this person's saying, even with the Champix tablets, I'm still thinking about smoking. And then when the message came through, it says like, Felix, don't do it. And I'm like, oh, okay, all right, I won't. I thought it was really helpful. So they do tend to kind of highlight that there is more of a benefit from doing this than the cost. So, technical issues. As I mentioned earlier, there's this issue with not everyone getting Geofence support. There was a slight issue in some of coding, which is now ironed out with the second version. The proportion of people who receive Geofence support seems to be higher in our ongoing acceptability study, though it's still not as high as we would like. Another factor was that when we did this original study, we had quite a narrow geofence diameter. So if you think of geofence being one concentric circle and then your location being usually a smaller one, the way the geofence service works, which is run by Google, is that the little circle, or the circle that represents where you are, needs to be completely in the bigger circle. So if you have quite a narrow geofence, and then suddenly there's a lot of uncertainty about your location, then it's not sure if you're in there or not, so it won't do anything. Of course, one solution to that is to widen the geofence circle. It reduces the sort of accuracy of the geofence triggering, but it at least increases the chance that people are going to get it. And for some people where there are areas where they don't have good location accuracy, then that can be an issue. I think that has been. So we have widened that geofence diameter. In terms of privacy concerns, generally they didn't really have any, which was a bit surprising. But it seemed to be because it was a university kind of developed app. So, this person says, I would have been happy to give more time, more personal data, things along those lines. Whilst if it was, I don't know, it's being recorded, name of a commercial pharmacy, or someone along those lines coming up with an app, I would have given them the bare minimum because I don't trust where that data is going to go. So this has obviously implications for commercialisation in industry, but for the time being, it doesn't seem to be a problem with the sort of research that we're doing among this group of participants. It might be there are not a bunch who are attracted to the idea about this kind of app. So we'll continue to observe that. Okay, so just some conclusions from this particular study. It didn't take very long for people to report smoking. That was a positive. But I think we need reporting interventions. And we have implemented a number of those in version 2. It's too early to say if they're working, but from looking at the data so far, it does look like people are reporting a lot more. It could be that they're heavier smokers, but we need to look at that. But like any intervention, that's digital intervention and so on, you need 2 interventions, don't you? You need one to get them to use the intervention, and then the actual intervention to kind of help them to change their behaviour. We could, and as we have done, lower the geofence threshold so that we don't need people to report all the time. And in a way, we don't actually. If we're doing an EMA study, then we do want people to report all the time. But if we're doing it purely as an intervention, they might not need to report every time they're at home. But once they've done it a few times, the system can identify that they're at home and that that's a geofence and so on. We did find quite good engagement with these messages. But they're not always viewed promptly, and I think we need to kind of explore how we improve that and what factors might do that, and that's a sort of ongoing work, as I mentioned. So far, privacy issues for this particular study and this sample were negligible, but the source is probably likely to be important, so that's something to bear in mind. So we've got this ongoing acceptability study, which is pretty much ended in terms of data collection. But as I'm sure, as you know, those of you who work with these sorts of apps or other kinds of interventions, you get a lot of data, and it's not very penetrable at the beginning. So it takes quite a lot of work to actually to get into it and analyse it. So I'm mindful of the time. I did have a little section on machine learning, but maybe it would be more useful to have a bit of a discussion. So, yeah. Okay. So I'll end there, and we come on to that topic and we can talk about it.